The spread of breast cancer follows an orderly progression, predictably metastasizing to the first regional lymph nodes. In this case, sentinel lymph node biopsy is performed to identify key lymph nodes draining from a primary tumor that may harbor cancerous cells. Frequently, there is more than one key lymph node draining from a primary tumor that must be detected for accurate staging. Lymphoseek is a novel, synthetic, soluble molecule called tilmanocept, which is radiolabeled with technetium Tc99m. Tilmanocept molecules are relatively small, 7 nanometers in diameter, and each one carries multiple units of mannose. After local administration, Lymphoseek undergoes timely and consistent injection site clearance. In clinical studies, Lymphoseek has been detectable in lymph nodes within 10 minutes and for up to 30 hours post-injection. Lymphatic mapping and sentinel lymph node biopsy should be conducted from 15 minutes and up to 15 hours post-injection. Lymphoseek transits through the lymphatic vessels and begins to accumulate and bind tightly in key lymph nodes draining from a primary tumor within minutes. Lymphoseek is a receptor-targeted lymphatic mapping agent. Its mannose components have a high affinity for a receptor protein known as CD206. These receptors are found on the surface of macrophages, which are present in high concentrations within lymph nodes. Lymphoseek is purposely designed to target and strongly bind to these receptors. Selective and tight binding with Lymphoseek identified on average 2.1 pathology-confirmed lymph nodes per patient, with a range of 1 to 8 in patients where nodes were identified. Its receptor targeting properties enable correct identification and localization of key lymph nodes draining from a primary tumor. Lymphoseek may be used alone or in conjunction with vital blue dye, an agent commonly used for direct nodal visualization. Receptor-targeted lymphatic mapping with Lymphoseek utilizes a distinct mechanism of action. This novel mechanism allows for accumulation in lymphatic tissue and rapid transit from the injection site, so as not to interfere with sentinel node identification. As the first and only receptor-targeted lymphatic mapping agent, as demonstrated in controlled clinical studies, Lymphoseek can reliably identify tumor-draining lymph nodes, facilitating the appropriate staging of patients.